I'm here today with Bleddyn Rees, the head of our healthcare practice, and Bleddyn is going to explain a bit about connected health. So Bleddyn, to start with, what is connected health?
So connected health is a generic term for a series of different types of health. So digital health, m-health, e-health, telecare, telehealth, telemedicine. The real problem here is that there is no legal definition. Indeed, there's no agreed industry definitions. And what this is a barrier really to the development of the sector, because one person's telecare could be somebody else's telehealth. So people can be talking at cross purposes. And for that reason, we produced a white paper a few months ago explaining what how these terms are currently used to try and help clarify the use of the vocabulary, if you like, in the sector.
And why is it so important?
Well, pretty much every healthcare system around the world is going to become bankrupt unless there is significant change to the systems. And in fact, for healthcare, you could also say social care. So the real problem stems from aging population. There are just many more of us living longer. And secondly, when we live longer, we have what are called long-term conditions. So cardiovascular disease, diabetes, asthma, COPD. And the treatment of these longer-term conditions is just costing so much money, and we just can't afford it. So the use of technology to improve the quality of services, the efficiency of services, and frankly just reducing cost is absolutely essential to every single health and social care system around the world.
And what do you see as the key changes in connected health over the next few years?
I think there are three important changes. The first is about interoperability, which for the techies, this is about how do you make different systems, whether it's computers or whether it's smartphones, work together. So an example of that is that the European Commission and the US Federal Department of Health have a whole project around interoperability. And an specific example would be something called the Trillium Bridge, which is the idea that US citizens can have access to a summary care record when they're in Europe and vice versa. So interoperability of systems is one. The second is the international development of healthcare markets. So what businesses need who are involved in connected health is to be able to deploy this technology, these services at scale on commercial terms. So we're not going to see in any particular countries real significant change until these international businesses can start to actually penetrate multiple countries. So that's the second reason. The third sort of development is a number of important EU initiatives that are taking place. So there's something called Horizon 2020, which is substantial funding across European countries to develop new services and technologies for both health and social care. There's something called AAL2, which is Assistant Ambient Living, another substantial amount of money for innovation in healthcare. And then finally, there's a very interesting something called EIT, so it's the European Innovation and Technology, and it's got something called Knowledge Information Centres and Innovation Centres, and they will be at the forefront of developing new services and systems and then rolling it across Europe. So you're going to see quite a bit of activity on a cross-border basis in Europe.
And does that mean that EU health laws will be affected?
I wish. The real problem with EU health laws is that there's no harmonisation, and there are no plans in the short term to see harmonisation, and that's a big barrier. And for small startup businesses, that makes understanding the regulatory positions in each country complex and expensive, and prohibitively expensive, to be truthful. So it's a big problem. What in the short term we're going to see is the reform of data protection, and clearly the draft directive is there, and that has a big impact on healthcare and social care as you see the emergence of big data and predictive analytics in healthcare. And you're going to see some things around some cross-border activities, probably in relation to general commercial contractual terms again, but nothing specifically on health, and that's a big barrier. going forward. And then the final thing is medical devices. So you need to be watching. So not many software engineers, for instance, understand that if they're running algorithms that are used for diagnostic purposes, they've got a medical device that needs to be registered. So the medical devices regulation is going to be changing in due course. And then also there's something at the moment called a green paper on mHealth, issued by the European Commission, and that's all about health apps. And that potentially has quite an important effect on the development of policy on health apps, and how do you regulate them, and how do you ensure that they're safe or not safe. And as you start to see GPs, for instance, prescribe apps to patients which are either information systems or ways in which they can monitor some of their long-term conditions, the importance of that type of regulation is going to become obvious to the public.
You've mentioned mHealth there. Can you explain what that is and also just give us a bit more information about it?
The M simply stands for mobile, and for many people just don't think voice, think it's just using your mobile device to transfer information and data. So the significance of mHealth is that essentially in the developing world where there's either no hospital infrastructure or primary care infrastructure, or it's at considerable distances to where people are, there's a necessity, because there's the absence of that infrastructure, to use mHealth solutions to be able to treat people. So, for example, if you have a mother who's pregnant and she's 300 miles from the nearest hospital, the idea that she can go for an outpatient appointment, it just doesn't work. So in the developing world, so in particular Africa, India, and the Middle East, a lot of these countries are making significant use of mHealth. And in fact, the really, really innovative use of mHealth will come in those countries.
And where do you see the big move in connected health coming from?
Without any question, it's going to be the developing world. So the countries that don't have hospitals, don't have primary care facilities, or where they're some considerable distance from where people are. So obviously Africa, and that's one area. But perhaps the more interesting, for me, because a lot of people will readily recognize that, but for me, the really interesting area is other industries that are going to disrupt healthcare. So, for example, the automotive industry, the aviation industry, the energy industry, and the defense industry. And people will look at you and go, well, why is that? So some examples. Cars are packed full of sensors. So the things that turn your windscreen wipers on in the wet, your headlights on in the dark. Bosch perhaps, for example, have a huge patent portfolio, and they are essentially using those sensors and redeploying them to connected health. The aviation industry is doing exactly the same thing. So Airbus around Toulouse sees its biggest market after planes as the healthcare sector. Interestingly, defense, so companies like Lockheed Martin, and I had no idea till recently, why they would have any involvement in health, but they build supercomputers. So they build the sort of computers that do genomics and run biobanks for countries like Canada. And then energy is really very interesting. And this is about, for instance, that people have been ill on ships for centuries and hadn't realised that they've got a wealth of information on telecare from hospitals in places like Norway, providing services to sailors who are ill on ships. But perhaps more interestingly again for them, as the energy companies go into very remote parts of the world, Greenland, again Africa, China, where there are simply no medical facilities, where they're using some incredible technology to deploy healthcare services for their employees.
How do you see this working with the different expectations that the different generations might have?
My mother, who's 93, she's very grateful for whatever the NHS dishes her up, if you like. But my son, in contrast, expects to be able to book his appointment with his GP in the same way that he books his flights or his hotels when he decides to go on holiday at the last minute. So there's extremes where elderly people are often they just accept the service the way it's delivered. But the younger generation expect to be able to use whether it's e-services, how you want to describe it, or whether you just want to say it's just the full use of every type of digital communication. And people who are in the middle of those two generations, if you like, we're probably a bit of both. And the truth is that the expectation of services varies considerably depending on your age. But more and more of us are becoming consumers. We see the delivery of health and social care as consumers. The advent of personal budgets in social care, for instance, means that we all have increasing expectations of public services. And one of those is the way they are delivered, and that's about communication tools.
I've heard reference to permanent connected health ecosystems. Can you explain what they are?
So this is the idea that you create large population bases, either big cities, regions, or countries. And what you do is you pull together in a coherent way all of the different stakeholders who are needed to deploy connected health at scale on commercial terms. So, for example, you bring together providers of health and social care, both public and private, so hospitals, GP practices. You then bring together the wider public sector involved in health and social care, so departments of health or Department of Health and Social Care if it's integrated, quangos that are effectively regulatory bodies. You then bring universities who teach clinicians and nurses, dentists, ophthalmologists and allied healthcare professionals, the business schools from the universities that will investigate and research on both financial and clinical evidence base. You then pull in housing, so you get the holy trinity of healthcare, social care and housing. So you get organisations like housing associations, and then you bring in industry. And industry comprises international businesses, whether they're in telecommunications, pharmaceutical or technology, and everything from SMEs and spin-outs from university, all involved in the health and social care sector. And what you do is the ecosystems have a quarterly business agenda, and they meet and they pursue strategic goals of the health and social care system, because the departments of health are integral members of that ecosystem. And so it's real business, it's doing, not talking. And what you're essentially doing is breaking down silos inside public services in particular, but also between the public sector and the private sector. And the European Connected Health Alliance ecosystems, what they start to do is transfer best practice and lessons learned from one country to another through the ecosystems, accelerating learning and R&D and accelerating deployment. And in that way, what we're actually doing in those permanent ecosystems is internationalizing and globalizing, if you like, the delivery of health and social care.
That sounds really fascinating. So these are actually happening in practice?
Yes, so 9 countries at the moment, and they're very diverse. So we have permanent ecosystems in Greece, France, in fact 3 in France on the way to being developed, 3 regions in Spain, so Catalonia, Valencia, the Basque Country, the whole of the Republic of Ireland, the whole of Northern Ireland, the whole of Scotland, ecosystems in England, in Manchester, one in what's called Northwest Coastal, which is essentially Liverpool and North, both jumping off in the English context of academic health science networks, and Manchester, the whole of Finland, Estonia, and the state of New York in the US. So a real diversity of systems and population bases, and also genetics between the different races. So very interesting. So it's been a busy 3 years, I think, for the European Connected Health Alliance setting these up.
What sorts of motivational tools have been developed in relation to connected health?
That's interesting. So it depends whether you're talking well-being and core health. So if you looked at well-being in the leisure market, this is not so much patients, it's consumers, it's you and I. So it's people who wear these sort of devices. So this is a Nike Fuel Band, but you could equally be using a Jawbone, a Fitbit, a Garmin, or a Samsung device at the moment. And what these sort of do is they're basically accelerators that are measuring your activity during the day. And they're linked to mobile apps. and then the app starts to record your activity, and it's displaying graphics. It's setting you targets. It's sending you messages saying well done and encouragement during the day, and if you like, it's a form of gamification. So the stuff that our children probably play with on the Xbox or the PlayStation, it's similar technology and similar, if you like, theory behind it about how you motivate people. So at one level in well-being, you've got that type of thing, and then on the more sophisticated, genuine health. Connected health technology and devices, you've got things that are monitoring heart, let's say your heart rate, stress rate for people who might need a bypass, and that's a reassurance more than motivating. It's in early stages. It's giving them confidence that actually they're not going to suffer a heart attack, that everything is working fine, or knowing that somebody's looking at them at the numbers and being able to speak to them. But over the next few years, one of the really interesting areas is going to be how psychologists and others look at how we use data and how you motivate all of us to live healthier lifestyles, whether that's what we eat, whether we eat things or we don't eat, our lifestyles in terms of how much exercise we do, as well as living with more significant long-term conditions and making sure that we're stable and not admitted to hospital. So I'm a late onset asthma, so it's important for me to manage that condition so that I'm not admitted to hospital. Thankfully I've never been admitted to hospital, but that's the whole point. If I'm well and my quality of life is good, that's fantastic for me, but also for the healthcare system. It means they're not paying for expensive admissions into hospital and treatment for me.
And just to finish, Bleddyn, what do you think all this means for commissioners, for service providers, and for in-house lawyers?
So I think that a lot of people, this is very new. So they may be aware of one or two of these sort of technologies that are out there, but there aren't many people, I think, who yet understand the totality of the picture. So if you're a commissioner, what your fear is, how can we afford and pay for the rising demand from people living with long-term conditions? So it's really important to understand what technology is already out there, how it's developing, and how you might redesign services, both in the short term, as in the next 24 months, let's say, but also over a 5 or a 10-year horizon. So you need to understand some of this stuff, if you like, and you need to be planning to be able to use it. If you're a provider, this is a way of being able to reduce your costs, improve your efficiency of services, but also the quality of services that you provide to patients. And again, it's about understanding what is out there, what's coming. Also being part of the solution, because many of these technology businesses, for instance, need to work with leading hospitals and clinicians to be able to actually refine their ideas and produce things that are actually better for everyone. So clearly, commissioners and providers, there's an obvious reason to be involved. In public healthcare terms, again, predictive analytics is key, and then genomics and big data. And this is all about being able to predict that someone's going to have a stroke before they have it, to prevent it. So not only is the individual's quality of life obviously substantially better, but you don't have permanent disabilities which require social care services. So the use of big data going forward is going to be really important. And then for lawyers, it's starting to understand that there are some real challenges here for all of us because of the failure to harmonise laws across Europe. And some people might think, well, it's not here. He's talking about something that might be 3 years' time, but I could name a mental health business that provides online services to people, and it's here and now. And it has, when the UK goes offline, they have a New Zealand operation that kicks in to provide 24/7, 365 cover. Now, you have to start thinking, so what are the implications of that from a legal point of view? And we're going to see more and more contracting, and people just won't even know that actually an element of the service delivery is international. And so what are the terms that we're going to put in? How are we going to deal with the regulatory issues, whether that's someone like CQC, for example? So there are obvious challenges that are here and now. And then many people, as I said earlier, don't understand the relevance of medical devices. So there's some highly specialized law in here for lawyers. And the quicker we all start to become generally aware of what they are, so that we can ask the right questions of clients who are contracting and start to understand that even though we might be commissioning a service in Birmingham, that service or an element of it could be being provided anywhere in the world, and we might have no idea that that's happening. So there's a sort of interesting due diligence and commercial due diligence as well.
Thank you, Bleddyn. That's been really interesting, and I think we've all got a better understanding of what connected health means.
Thank you very much. Really enjoyed that.